Hi, my name is Emily Johnson, and I'm a family physician in Colorado Springs, Colorado. I work at a clinic called the Developmental Disabilities Health Center, where I provide primary care for adults with intellectual and developmental disabilities. I also currently serve as the VP of Policy and Advocacy for the AADMD. I wanted to share a little bit of my experience in developmental medicine and choosing my career path to this point. I've been involved with AADMD for a while. I started as a medical student, and it has really helped me throughout my career in determining where exactly to go and how to get involved in this field and in advocacy efforts. My original interest in developmental medicine came from family experience. I am the younger sibling of a young man who happens to have Down syndrome and was involved in many different organizations growing up as a child. I think I got involved in Special Olympics as early as middle school and was involved in things like Best Buddies and other organizations through college, and then continued to be involved in medical school. And at that point, like I said, was when I got involved with AADMD. I had originally thought when I went to medical school that I would be a developmental behavioral pediatrician. I knew I wanted to work with people with intellectual and developmental disabilities, and so that seemed like the most clear path to do so. However, as I got further into my medical training, I started to realize that it seemed like the pediatric world provided pretty good supports for people with IDD, but once they got to 18 or 21, whenever their pediatrician said they no longer felt comfortable treating them, the available services, especially in the medical field, seemed to drop off. At that point, I really decided that I wanted to be able to fill some of that gap for the adult world, and so I debated between med-peds and family medicine for some time. It felt a little bit like splitting hairs, but I ultimately decided that family medicine was the best path for me. I wanted to be able to take care of kids and follow them into adulthood and make sure they didn't have that same fall off the cliff. I was fortunately able to find a residency program that allowed me to pursue that quite freely, got some specific training in caring for people with intellectual and developmental disabilities in the hospital, in clinic, and in a specialized adult developmental clinic. This was at Tacoma Family Medicine in Tacoma, Washington, and I really got to pursue this specific field. As of now, there's not a ton of specific adult training programs for developmental medicine, and hopefully this is changing in the next few years. But there's so much that you can learn on your own through specific programs that you can find that fit your needs. Ultimately, I felt like getting good base training was great, and pursuing a lot of my own experiences in developmental medicine was where I filled in those gaps, and AADMD through conferences and connecting with other physicians has really helped to make sure I knew what I needed to know to provide great care for adults with intellectual and developmental disabilities. Another big part of this field for me, and I think you'll hear this from many of the other physicians at the AADMD, is trying to be a good advocate for our patients. It is clearly an underserved population across all fields of medicine, so no matter what field you decide to go into, there is a need. All of our patients really need good primary care. They need good specialty care. And so you can really fill a good niche if you decide to really dedicate at least some of your practice time for people with IDD. Even if it's not your whole day, like it is for many of us, it's a really big service and a really big need just to have somebody that's willing, interested, and knowledgeable about people with intellectual disabilities and their families. I would highly encourage you to learn as much as you can through AADMD and other avenues in order to be able to provide this care. I also encourage that when you're no longer a student or resident that you stay involved, because like I said, although there's so much good you can do at the bedside, being involved in advocacy is something that is really valuable to me, and I think ultimately has a really broad impact that allows you to go beyond what you can do with each individual patient. As I said, I'm now the VP of Policy and Advocacy for the AADMD. This is a relatively new role for me and has been a big learning curve. However, I think it's been a very valuable experience and something I would encourage you to consider when you get into whatever ultimate job that you're in. Being an advocate for your patients outside of the exam room, I think, is something that you'll find extremely valuable. During COVID, this has looked a variety of different ways, whether it's trying to advocate for patients to make sure that they have visitors at the bedside and when they get hospitalized during the pandemic, advocating that they get prioritized for vaccines, and advocating that they don't get left behind when considering allocation of scarce resources in the hospital. This has been a particularly active time for advocacy, but you can see that those things will also apply outside of the pandemic, and there's always things to advocate for, especially for this patient population that's underserved both medically and socially. I'd be happy to speak with anybody if they had more questions about my career path or ways to get involved. I'm really glad that you have some interest in learning more about people with IDD and how we can best care for them from a medical perspective. Thanks for taking the time to watch this video, and best of luck in your career.